Hi, my name is Rayleigh Johnson. I work at the Sioux Falls Area Humane Society as a veterinary assistant, and today I'm going to be showing you how to administer sub-Q fluids on a cat. Sub-Q fluids are typically administered to manage and prevent dehydration. Owners are sometimes sent home with fluids to do themselves, so I'm going to take you through the process. The first step is to gather materials. Here we have a fluid bag, and we also have the fluid line. This is already connected to the bag, but typically you would just take the needle cap off and slide it right in there. There's also a clamp which controls the flow, and the end here has a needle. The needle needs to be switched out each time, so I'm going to switch it out right now. Just twist it off and open the cap to this needle, twist that one on like so. So next we're gonna prepare the animal for fluids. She seems pretty tolerable right now. She's just kind of relaxing, doing her thing. We also need to evaluate, does she need fluids? A few ways that you can test this are a skin tent test, which you just pull up the skin here, and if it kind of slowly, flows back down, it doesn't immediately snap down, that's an indication of dehydration. We can also test the CRT. She has dark gums, so it's kind of hard to test it, but you just press down on their gums, and then the refill time to her normal color would be anywhere over 2 seconds would indicate dehydration. We typically here administer the fluids in between the shoulder blades. They can also be administered on the leg, on the side of the body here. So we will just take the needle cap off, and we are gonna tent the skin, kind of like the skin tent test, and just slide the needle right in. This is subcutaneously, which means it's in between the skin and not into the muscle. So we're gonna kind of hold our needle in place, and we're gonna unclamp this. So once you unclamp this, you're gonna see a flow or a drip start to come out here. That means the fluids are being successfully administered. And now we just need to maintain the patient's comfortability, make sure she's all good. So you'll clamp this here when you're done, and then you'll just pinch the skin to make sure that it closes properly and no fluids come back out, and just slide the needle back out there. And then to safely dispose of the needle, we're just gonna twist this off and dispose it into a sharps container. Bam. Thank you so much for watching. I hope that this helped clarify how to do subcutaneous fluids. If you have any questions, you can obviously follow up with me or your local veterinarian. Thank you.